With no further ado, let's get started. So, basically, I like to start with a little bit of lightheartedness because we're going to get into some hardcore science. So, enjoy it while you can, and then we're going to take it from here. So, we're working on strengthening your immune system. As I said, it's going to be a research-driven approach and to protect against infections like COVID-19. So, good news for all of you, I can't see you. So you could look like Doggy on the left. I'm doing my best. I know I didn't quite meet it, but to look like that cute little guy on the right. Well, here we go. So when did our lives change? Not December 31st, because most of us weren't really taking this seriously when we saw what was going on in China. You know, why would we think that something like this could ever happen? And then all of a sudden, around March 11th, Tom Hanks gets sick and the basketball players start getting sick. And we started to say, well, maybe all those, things we saw on Facebook that were going on in Italy, we should have taken more seriously. And it escalated really quickly, as you all know. I don't have to really tell you all the details, but, people are walking around saying it's the flu. The same number of people are dying, which isn't true. But we're not just looking at mortality, death rates. We're looking at things that are very unique to this virus, what we call long haulers, post-COVID syndrome. In Italy, at least one symptom was still being experienced by people. 87% of people, 2 months after they left the hospital, 55% of them had some serious symptoms. And we're seeing some odd things. We're seeing hair loss, we're seeing thyroid problems, we're seeing brain fog. Even in mild cases, people are still having lasting complications. And this is the things we're going to talk about tonight, how to prevent the virus, how to manage the virus, and how to mitigate the effects long-term of the virus. So most of you are local, New York, New Jersey, and as you know, the statistics lately are not pretty. They're going up again. This was as of October 14th. There was a 14% increase, 50,000 cases a day. So you see the graph. It's not going in the direction that we'd like, so we have to protect ourselves. So I want to talk about the phases of care. Early on, we saw that there was a lot of controversy over what to use. The typical antivirals we were nervous about initially because we were thinking, if we give someone too much immune potentiation, too much immune stimulation, immune support, we might push them into this overzealous immune response, that cytokine storm. But we've learned a lot since then. We've learned about when to do what, and I really want to explain that to you clearly so you understand. Now, here we go. What are we going to focus on when we say prevention? And when I say risk of exposure, that's us. Most of us, I think, are being cautious. We're wearing our masks, but we're in a high-risk area. So what we want to do is we want to optimize the immune response. We want to make our immune systems work. But we want to also reduce that baseline inflammation. Because if we're starting out high, there's a better chance that we're going to end up in that place we don't want to be with that runaway inflammatory immune response. So here's the way the immune system works. We want it to be activated. We want it to say, I'm being attacked. I got to get started. I got to start to protect the host. That's us. And if the immune system is working optimally, you get a mild infection. You get a flu, you get a cold, you feel kind of crappy for a couple of days. Your immune system revs up, you get a fever, you're fatigued, your joints hurt maybe, but then you get better. The immune system needs to see that virus. It needs to make inflammatory chemicals. That is part of the response. A little, great. A lot is when you get into trouble. That's what we're trying to avoid. So I know this is boring, but when I read the research, this will help you understand how valid this research is and what it's really showing you from an evidence-based perspective. So these Th1 immune cells, our immune system has this balance between Th1 and Th2. Th1 goes after the pathogens. These are our fighter jets. These are the killers. The natural killer cells, just like what they sound, they are the frontline defense system. We want them to see this virus before it slips under the radar. This is the rapid response team. These turn up Pac-Man, macrophages. Picture a macrophage like that scrubbing bubbles commercial where it like eats up the things with the Mucinex. That's your macrophage. They eat up the virus and spit it out dead. Th2 is the other part. We want Th1 and Th2 to work together. If you're more of an allergic, eczema, asthma, allergy person, you probably have a more aggressive Th2, and we need to maybe work a little harder on that Th1 antiviral support. And then there's those spike proteins. You know, when you see those pictures of the COVID virus and has those little things pointing out of it, that's how it sticks to your cells and invades. So we want things that are going to block the spike proteins. So these are some of the complications that are unique to COVID that make it sneaky and slippery and under the radar dangerous. It can evade the immune system. It could slip through. And by the time it takes hold and the immune system gets wind of it, the immune system kind of freaks out. And that cytokine inflammatory response that should be, you know, over and done, you know, mild, gets really upregulated, persistent, excessive inflammation. But the second strategy is to make sure that when the immune system turns on, it doesn't run away with you. You don't have this overzealous inflammation. So one more kind of science slide, then we'll get to more good stuff. IFN is what's made by that Th1 and the macrophages. All of that's all involved, natural killer cells. We want it to kick in early. See the yellow part of the graph? We wanted to say, okay, virus, I see you. I'm gonna respond and I'm gonna shut you down. If the virus slips in and the viral titers are too high, see what happens? That's when we see a much more aggressive course, not a milder course of disease. So this is a really cool graph. And this is what Julian's gonna discuss with you also because of lifestyle and what we call comorbidities. As you all know, obesity, diabetes, hypertension, all cardiovascular diseases, chronic kidney disease, put people at higher risk. So if you're at a low baseline level of inflammation and your inflammation goes up about this much, you're still in a safe zone, usually. If you're starting out here and your inflammation goes up the exact same amount, you can enter a much more dangerous, risky phase. So by lowering your inflammatory markers and your inflammatory state and your comorbidities initially, you're much less likely to reach that threshold for acute respiratory distress syndrome. And I say as an aside, when this first hit the fan, a lot of my patients, all of us to some degree, kind of derailed. You know, we weren't getting food, we were freaking out, it was very scary, and everyone just let themselves go a little bit. Then all of a sudden, people started to say to themselves, you know, this isn't the worst thing in terms of being home, not having to drive to work. You know, things were quiet. And a lot of my patients, the majority, started to take care of themselves. They started to say, wow, I have a little more time to cook. I could exercise. Let me climb out of this hole. And what they were effectively doing was really helping to prevent and reduce their risk. And that's what I really want you to understand. And that's why I'm going to turn it over to Julian in just a minute, and he's going to explain how to do that. Just want to get into one more thing. This is the last scientific thing I'm going to really say. So just bear with me. NLRP3. Think how smart you're going to sound tomorrow when you talk to your friends about this. NLRP3 is a main driver of inflammation in COVID. It's also upregulated and a main driver of inflammation with obesity, diabetes, heart disease, kidney disease, bacterial imbalances in the gut, gout, cancer. So what happens with this is that if you already have upregulated NLRP3 from these other disorders, then if you get COVID, you're at a much more of a disadvantage. And lastly, before I turn it over to Julian, just to give you a little taste of what's to come, there are natural NLRP3 inhibitors, curcumin, quercetin, melatonin, green tea, resveratrol, and this is all really very substantiated in the literature. So with no further ado, Julian.
All right. Hi, everyone. I hope you can see me. I hope you can hear me. My name is Julian Ribinik, and I'm going to discuss effects of how high carb diet affects us and what we can do about this. So I'm going to share my screen really quick, if I'm allowed. If anyone cannot see the screen, please make sure that you let us know. All right, we're going to discuss, as I said, effects of good diet and bad diet on the COVID, and let me go and talk about myself a bit. So my name is Julian Ribinik, and I'm a health coach and nutritionist, but just 5 years ago, I was an obese corporate manager with terrible eating and drinking habits. as you can guess as well, a full-blown selection of metabolic syndrome symptoms. I was lucky to meet Dr. Adria, and she helped me to become a different person inside and out, as they say. And she was my inspiration to switch gears, become a health coach and wellness adapt, start my own low-carb based health coaching practice. And now I deal with weight loss and lowering inflammation and stabilizing blood sugar for people who need that. What I do, I work with clients in an online setting, one-on-one, with constant follow-up and accountability, and I lead them to their goals. And currently, I'm also working on scaling my practice to an online group setting. So as you can guess, that was a segue. The low-carb diet, and as many of you know, practicing a low-carb or ketogenic diet will cause systemic inflammation to go down, and that obviously elevates our immunity, and that's a great thing. It's very, very relevant to current pandemic, and as you know from press, from social media, from all those places, we do know that absolute majority of people who get the virus, they had pre-existing issues, comorbidities, different conditions. So what they get sick and get diagnosed are not necessarily sourced in the virus itself, but then eventually they might die from that virus. And also those people are older people. Now, by decreasing inflammation and lowering insulin and blood sugar, we can help ourselves to slow down the aging, and we can change our biological age so it would match the chronological age. People who have healthier systems live longer, and this is what I'm talking about. Lifestyle, exercise, things like that help us to change the dynamic as well. We can change date of birth, but we can definitely change the biological age. Let's have some facts. Just 300 calories of sugar, glucose, they decrease your immune system's efficiency for 2 hours by 50%, and this is huge. So think about that. You can go and eat a pie or eat a pizza and go outside and catch a virus just because of that. How sad is that? Now, look at the facts on the screen, right? All those unpleasant things, but most of Americans have comorbidities. Most Americans are obese, overweight, and medically obese is, even when you go into acceptable phase, you're still medically obese. If you go to the doctor, they check your BMI. So essentially that's 3 out of 4 Americans who are not well like that. And there's only 12% of Americans who are metabolically healthy. So let's talk about obesity for a moment. And what matters here is that visceral fat that we have in our gut is really, really inflammatory. All the diseases like cardiovascular disease, hypertension, diabetes, elevated blood sugar, autoimmunity, they all lead down to the path to, being more compromised immune system. They decrease our chance of getting well from COVID. And most older people who have those things don't end up well with that. And just, fun fact is obesity is #1 reason for hospitalization between ages from 18 and 65. All right, now, how many people do you know that are on low-carb diet or ketogenic diet? And it is pretty popular, so I'm sure everyone knows someone. And if that person is for a long period of time is being on the diet, do you know anyone who's obese still? Probably not, comparing to those who eat standard American diet. Most people I know who are following the diet for even 3 months, they drop weight tremendously, they reduce their visceral fat, and they get way healthier. They're lowering their blood pressure, blood sugar, insulin, all that. Now, Western diet is based on refined sugars. And here we go for that. Sugar works like cocaine, like heroin. It affects our dopamine reward center in the brain. And that's not awesome, right? It's essentially a drug. And when you use that, you can't stop using it. You need intervention. And while you can find a lot of research online, a lot of articles, documentary, whatnot, that says you need sugar, you know, to function, to have energy, to sustain yourself, it's not true, because sugar is not essential to our being. There are no such thing as essential carbohydrate for those who understand a bit about macronutrients. There are essential fats, there are essential amino acids, but no such thing as essential carbohydrate. In fact, there are populations who live way up north, like Eskimos, and similar, right? I'm not ethnograph, but those people historically have never had access to any carbohydrate. They didn't have any agriculture, and all their lives they lived on fat and protein, and they lived well. And still their descendants right now, they're very healthy, and they don't have any carbohydrate. Now, what about gut? Sugar is also very damaging to our gut, and our 80% of our immune cells are in the gut. It is where the nutrients are absorbed, and that makes perfect sense because the bulk of the pathogen comes from what we are eating. We worry about who sneezes on us, but we don't really worry about what we put in our mouth, and this is how majority of population end up being not so healthy. 53% of people who tested positive for COVID had virus in their stool. But what's interesting is that 23 had it in their stool while being tested negative. Fecal to oral transmission happens in bathrooms, and people don't really pay attention, don't wash hands, not being very hygienically understanding, and that makes people sick. Now, gut is a centerpiece of our health and performance, and it does communicate with our brain through vagus nerve. What passes your gut goes into your bloodstream, and what else is created in the gut is hormones, so their production is affected as well. Now, vagus nerve is a gut-brain connection, and it goes from your brain stem right to the colon, and it is 90% sensory. So it senses what's going on inside your gut and signals your brain very fast, so you can affect something. You ate something, something is going on, your brain is affected. Now, brain is 60 to 70% fat, so why do we need to consume carbohydrate for fuel? We do create those 5 grams of carbohydrate that we need on a daily basis automatically without consuming any. Our liver does that. Now, did you guys know that Alzheimer is called diabetes type 4? This is because it has to do everything with your gut. So prevention on neurodegenerative disease will benefit a lot from healthy gut. Burning sugar, what it does, it elevates systemic inflammation. When you're on low carb and ketogenic diet and burning ketos for energy, you add anti-inflammatory properties to your fuel. And your food now keeps you healthier. Fat is a very important and clear fuel comparing to carbohydrate. And while sugar disproportionately affects your detoxification by putting you into excessive insulin production, which brings you to oxidative inflammatory state, which is the basis of all disease, liver can break down toxins when sugar is in excess. So toxins are recirculating and they hit your brain. Fat is food for brain, sugar is food for pathogens, and we don't really love sugar. Our brain does because it has a drug effect, but our body doesn't. And it is a drug. And with that, I will pass it back to Dr. Adria, and she will continue the discussion. Hope that was useful.
Thank you, Julian. That was great. I think a lot of people don't realize that sugar and carbohydrates are not essential nutrients. You don't need them. I mean, they don't do most of us any good. So let's start again at the first phase of this, which is prevention, early infection. The reality is, this is where most of us need to start because look where we live, right? We're in New York, we're in New Jersey, the rates are going up again. So let's assume that we could always be exposed. What do we do to really protect ourselves? So let's think about where the virus starts, right? It starts by invading the respiratory tract. Julian mentioned the gut too. I'm going to start with the respiratory tract and go on to the gut a little bit, but that's why we wear masks. Our nose, our mouth, even the eyes are covered, especially in a lot of high-risk situations. Physicians will wear goggles. So what do we want to do? Think about it this way. When you get exposed to a germ, a virus, a bacteria, you don't get sick the minute it enters your body. It has to take hold, right? It has to start to replicate, duplicate, multiply. So what happens is, if we can nip that in the bud, if we can say, all right, you're in, but I'm getting you out before you have a chance to start inviting all your friends to keep you company, then that's what we want to do. So we want to wash them out. We want to block the replication. We want to support the gut with probiotics and things that really help the barrier in the gut, since over 70%, as Julian said, close to 80% of the immune system's in the gut. So it's not just that we don't want the gut to get infected. We want the gut to be strong because that's where our immune system lives. So let's protect those barriers. So here are some fun. The word fun has taken on a new connotation with COVID, but things that we could do to protect those barriers. So oil pulling. The outer coating of the SARS-CoV virus is covered in fat. Other fats behave like a magnet to this fat. So if it's starting to get ingrained in your mouth, in your cheeks, in your tongue, what you want to do is you want to invite it to leave. You want to use a magnet to pull it out. And that magnet is other fat. So what you do is you take some coconut oil or other oils. Coconut works well because it doesn't taste bad and it's kind of thick. And you swish it around in your mouth for about 10 minutes. You swish it around and then you spit it in a trash can, only because you don't want to clog your sink. And that will help reduce the viral load. Herbal teas, when this virus first started, I made a beeline to all my supplement companies to order all the good antiviral herbs and the immune supporting herbs, but a lot of them were in short supply. Companies were going out of business. They couldn't keep up. So I went on the email and I went on computer and I ordered from Traditional Medicinals. And these are different herbs that, block viral attachment. They have antiviral properties. Keep them next to you. Drink some tea. When it gets cold, gargle with it. Leeks, garlic and onions, sulfur vegetables, tempeh as well. Most of you have heard that if you're type A, you're at higher risk. I don't know if you're just necessarily at higher risk or type O, you're more protected, but it seems that more people who had an escalation of the virus were type A. And certain things help with the way the antibodies work, and that these certain foods help to kind of affect that response. Silvers, colloidal silvers, nasal sprays, mouth rinses. Again, swish it around, gargle with it, protect those surfaces. Propolis is honey, so propolis throat sprays. Iodine, salt water rinses, anything to kind of get at that barrier, protect that barrier and the place where the virus first enters. If you want to learn more about how to use iodine, Dr. Mercola and also Chris Masterjohn have some nice information on their websites about how to do this properly. Biocidin throat spray, that's an antimicrobial herbal throat spray. I really like that. I feel like I think that saved me a lot of times when I've had some major exposures. It's a little more potent in that it has more of an antimicrobial and herbs to affect, actually killing some of these pathogens. And aromatherapy, that's your nose. So using aromatherapy, even just sniffing essential oils, these are all some nice techniques to help to protect. Then there's something called HOCl, hypochlorous acid, and not enough people have heard about this, but I absolutely love this. This is a non-toxic antimicrobial. They're using it in certain places like doctor's offices and surgery centers because it's totally non-toxic. We're going to be getting it in our Staten Island office in a fogger. You can make it yourself, or you could purchase it already in the form of hypochlorous acid. I keep a little spray bottle of this in my purse. We have them in the office. And when I leave a place, go to Whole Foods, I literally spray it in my face. Spray it, it gets in your eyes, your nose, your mouth. It doesn't seem to bother anybody. So if you want to learn more about, purchasing some of these larger products for industry, Ecolux is a good resource. So now I want to start by talking about what you've hopefully all been waiting for, what to do, what supplements to take. So when I mean foundational, these are the ones that you're going to see have some great information with viruses and with COVID, but they're foundational. In other words, we should be on these now. Most of us need to be taking these to protect ourselves. So let's start with vitamin D. And I'm always amazed when I get patients in who don't take vitamin D. And what I say is, if you're never going to listen to anything I say again, just remember that you need to take vitamin D. If you don't take vitamin D, you will have a suboptimal vitamin D. The cutoff of 30, where the labs, if you're at 31, tell you you're normal, is not a relevant cutoff. That is not where healthy people want to be. That is not where you're protected. So what's so great about vitamin D? It reduces risk for infection. It supports the Pac-Man, the macrophages. It helps even with clotting. It protects your nervous system. But here's some really cool data. And again, most of this research is current because we didn't have COVID a year ago. So everything you're reading is going to be from 2020. So what they did was they looked at almost 200,000 people. And they found that the higher your vitamin D, the lower your risk of testing positive. That means the lower your risk of contracting the virus. And that people who did have the virus tend to have lower vitamin D levels. If you can keep your D at 55, well above the 30, you had almost a 50% lower risk of testing positive than someone below 20. And I see a lot of below 20, especially in elderly people, over 95% or 92%, I think. I don't remember the exact number of people in a nursing home prior to COVID, prior to when we locked them up and they didn't see any sunshine, had Ds in the 20s or below. So think about how rampant it was in that population. It wasn't just from age. This is a significant risk factor. If you're below 30, study from Israel showed, you had a much more increased risk of ending up in the hospital. So this is one that's just a given. We should all be taking our vitamin D. Does it increase the severity? Yes. If your vitamin D is low, you're more likely to get pneumonia and upper respiratory tract infections, as well as thrombosis. Thrombosis means blood clots. And it tends to occur, to Julian's point, more frequently in patients with diabetes and obesity. So this was published recently. This was a fantastic study. They looked at two groups of people that entered the hospital. So they had more serious cases. And they gave one group, 50 people, vitamin D, and the other group did not get vitamin D. The group receiving vitamin D, only one of the 50 people ended up in the ICU, 2%. And this was the older group. Of the 26 untreated, no vitamin D, 50% ended up in the ICU. So the conclusion was it really lowers your risk significantly of ending up in the ICU by 98%. So hopefully I've convinced you. I'm going to move on past vitamin D to vitamin A, kind of like its partner. They're both fat-soluble vitamins. This is important for that barrier integrity of the gut and the lung. And it's a catch-22. If your A is low, you're more likely to get an infection. You're more likely to have respiratory disease. And when you get an infection, it depletes your vitamin A. So what we do with people is we start them on a normal dose, 5 to 10,000, and then if they're infected, we increase the vitamin A level during the infection for protection. Zinc. So even our president took zinc when he was sick. That's probably what cured him. So anyway, lozenges are great because they coat the respiratory tract. Again, like A, if you're low in zinc, you have increased susceptibility. Zinc is responsible, or at least assisting in pretty much every part of the immune response. It is a potent antiviral. We want it to go inside our cells to block the virus. And you hear about a lot of people, and sometimes their first symptom or their only symptom or their lingering symptom is loss of smell and taste. Those are also symptoms of either too much zinc, which is highly unlikely, or a zinc deficiency. So perhaps a lot of these people, their zinc was really compromised during infection, and now they're deficient. So it would be wise to just consider zinc supplementation pre and post-infection. And almost half of the adult population does not get proper dietary intake of zinc, inadequate. So we like the lozenges. The lozenges, again, are basically where you want to have the response. It depends on the dose, but typically 10 to 15 milligrams. If you take zinc, a lot of times you may need to add some copper. They work in tandem. Too much zinc depletes copper, too much copper depletes zinc. There's some caveats to that. Women on birth control tend to have high copper. With cancer, unless we see a copper deficiency, we don't want to use copper. Good to use the zinc after meals or just in between, kind of suck on it. They taste good, so everyone tends to chew them, but keep them in your mouth as long as you can. If you have any symptoms, do them every 1 or 2 hours, at least for a couple of days. This was, again, 2020 research that shows that lower zinc, poorer survival outcomes. So, these are the things we're concerned about. We're concerned about prevention, but we're also concerned about the outcome to mitigate the effects of the virus. Quercetin is probably one of my favorites when it comes to COVID. It has a lot of mechanisms by which it's specifically anti-COVID. So it's an antiviral, anti-inflammatory, protective for the immune system. It's a zinc ionophore. What that fancy word means is it's a transporter. It helps put zinc inside the cells. Hydroxychloroquine is a zinc ionophore. So this is probably one of the mechanisms by which it did have some positive effects. It binds the CoV protein, that little thing that sticks out of the COVID molecule, the SARS-CoV molecule that helps it penetrate your cells. Zinc blocks that receptor so it cannot get in. They looked at thousands of different compounds. Zinc was in the top 5 compounds for the blocking, which is really exciting. This is hardcore science. Problem with zinc is that it's poorly absorbed. It doesn't really get in. So if we combine it with some fats, like in a phytosome form, it gets in better. Similar to curcumin. Most of the curcumins now are in phytosome complexes. The problem with zinc, well, of course, I shouldn't say problem, but the awareness you need to have is it can interfere with the metabolism of certain medications that go through a common liver pathway, just like grapefruit and pomegranate. So you need to check with your doctor for proper dosing and how to do this effectively and safely if you are on medications. Vitamin C, we've all heard about this. I think this was another one that the president had taken. Start with 1 to 2,000. And with an infection, we go higher. When we say bowel tolerance, that means if you start to get loose stools, you back off a little bit. Vitamin C, like vitamin A, helps with immunity. It tends to be lower when you get sick, so you need more. It's really concentrated in those macrophages, the Pac-Man. And again, once the body's infected, you need to up the dose. If you have kidney stones, if your iron levels are high, if you have hemochromatosis, you have to be more cautious with vitamin C. It supports the endothelium. That's the lining of the blood vessels. It helps to dilate the blood vessels and make nitric oxide, which is key with COVID. 2 grams a day, shortened ICU stay and time on a ventilator. Can dose up to 4 grams in divided doses, usually without any GI upset. Just like the absorption issues we have, to some degree, we have it with vitamin C. It is well absorbed, but if it's in the liposomal form, if it's fat soluble, it tends to get in better. And remember that fancy word that you're going to show off with your friends tomorrow, that NLRP3? It blocks the NLRP3 inflammasome. Glutathione, I know I said quercetin's my favorite, so maybe this is my second favorite. This is really an antiviral warrior. You don't have to be afraid of quercetin because we naturally have it in our bodies. But a lot of times due to genetics or due to high demand from toxin exposure, viral exposure, we have low glutathione. Oopsie, I did them. Partial to that quercetin. Low glutathione. So there are vitamins that help build glutathione, and deficiency may increase severity. It's really concentrated in the lungs, so we need that quercetin to do its job. Oh God, I keep saying quercetin. Jordan, you're gonna have to fix this for me when we edit. It's my daughter. So there was a study done, not a study done, kind of empirically done by Dr. Horowitz. He's a very well-known Lyme physician, integrative doctor up in the Westchester area. And I think it was his resident, his mom got sick with COVID and she was doing okay, and then she developed shortness of breath. So he gave her 2 grams of glutathione. Within hours, her breathing had improved, and he duplicated this with another patient or another person that he knew, and I'm sure he's done this again and again at this point. This was a few months ago now. So glutathione, it helps also if you're taking alpha-lipoic. We'll talk about NAC. These are some of the building blocks just to support this system. Anti-inflammatory, anti-cytokine. And here is NAC. One of my favorites, because not only does it block NLRP3, it builds glutathione, but the cool thing that makes it a little more unique is it's also a mucolytic. What that means is it's thinning the mucus secretions. It was proven effective against swine flu. And again, we have seen that things work against COVID, but a lot of times it's more mechanistic because we just haven't had enough experience. So we look at similar types of viral infections to see what has, you know, stood the test of time in the past. It inhibits viral inflammation, viral replication and inflammation. And again, this was the one specifically about COVID, saying that oral administration, so just taking it orally, can reduce the risk of developing COVID like it did for flu. So this was an August study. So more and more are going to be coming now for these nutraceuticals. Melatonin, you've probably heard about melatonin for COVID. Most of us think of this as a sleep vitamin, but it does way more. It's an antioxidant in the brain. It promotes that Th1. Remember my boring slide with the little soldiers? That's the early intervention slide. Blocks NLRP3, and it tends to be highest in young kids and pregnant women. So maybe that affords them some degree of protection, but as you get old, it decreases. So I don't really use melatonin for sleep, but I started using it when COVID came around. And it's something that, you know, again, it's an antioxidant protective in the brain, and it lowers that NLRP3 activation, plus helps with vascular leakage. So we're back to that risk for, you know, thrombotic events. Curcumin, this is one that a lot of my patients take even before they meet me. This has gotten a lot of press and it's well deserved. So I told you I wasn't going to talk about any more boring science, but I just have one more. There's something called IL-6. That's an inflammatory immune cytokine that we see with COVID really causes a lot of the problems. And curcumin is an effective IL-6 blocker. Antithrombotic. Now we all know what that means. It helps prevent the clottiness of platelets. It blocks the spike protein. It lowers inflammation. This is a very effective anti-inflammatory. So think cytokine storm and NLRP3. It seems to do everything that we're looking for it to do with COVID. So now let's get back to the gut a little bit. Probiotics are the soldiers. It's always good to have a few extra soldiers on hand. And then we want to work on barrier integrity. We want the gates to be really armed and manned. So Megamucosa is one product we use that helps with this, and SBI Protect. These have what's called immunoglobulins, and what they do is they can bind the toxins from infections and calm down the response, even from environmental toxins. SBI has a ton of research behind it, specifically, especially for like IBS and IBD diarrhea. So I use this a lot. I personally take this in my shakes every morning, just as an added bonus. I've been using the SBI Protect. But here's the thing with COVID, it can slip under the radar. We have to be protected before we get sick. However, certain autoimmune diseases, we don't want to potentiate that Th1 too aggressively. So if you're someone with an autoimmune disease, you really need to work with someone so you could do this correctly. For those with more allergic predispositions, they tend to do well with more Th1 support. And these are some of the herbs and different things that we use in the office: zinc, berberine, skullcap, echinacea, that stimulate Th1. Again, early intervention, don't let it slip in. But remember, if you're sick, it depends on your symptoms. It depends where you are in the phases. And obviously, if you're having difficulty breathing, if there's pulmonary involvement, you can't just stay home and take vitamins. You need to at least be seen by a medical professional. So let's say you're exposed, higher risk, early infection. Aside from the foundational supplements, you want to up the ante. You want to increase that glutathione. You want to think about Th1 support. You want to ramp up the curcumin to ramp down the inflammation. You want to use more vitamin C and vitamin A. Remember what I said, they get depleted during infections. You want to maybe think of the Biocide throat spray, and you want to have that oil pulling going on in your mouth so that you can lower the viral load. You want to think about supporting the first line defense system, the natural killer cells. Astragalus has a lot of data behind it for SARS-CoV-1 and CoV-2. Remember, this happened in China before it got here. And the Chinese doctors, they're very big on using herbs. So we have some really nice data. Andrographis is one I like. This can be used throughout because it's antiviral, but also anti-inflammatory. And the mushroom extracts, especially early on for that Th1 and anti-inflammatory immune support. Andro I like, and it improves lung surfactant. Think of that almost like the seal coating in your lungs to prevent those viruses from getting in. And it's anti-inflammatory while it's being immune supportive. This is a product we use sometimes in the office, just to give you some ideas of different things. This is a big Th1 supporter, and you don't need to take a lot of it. This is proven to increase the natural killer cells. Just to show you what's in it, give you some ideas. This has some mushrooms, beta-glucan, which is potentiates the immune system. It has some astragalus, it has some anti-inflammatories, the green tea, the pomegranate. It just discusses what this does. There's a lot of nice products that we use, and we kind of tailor it to what our patients need. Berberine, you may have heard of this. This we use in a lot of our antimicrobial protocols. It works really nicely for when we find unfriendly bacteria or yeast in the stool testing. It also is great for lowering blood sugar, which ultimately can help with cholesterol, and NLRP3, there we go again, inhibitor. It blocks this chemical called HIF-1 alpha, which is turned on in the body when there's not enough oxygen. So think how this can progress. You're having trouble breathing, you're not getting oxygenated, up goes HIF-1 alpha, which promotes clotting. And berberine, which is Goldenseal, also is a way to help protect against clotting and thrombosis. So you may see berberine as Goldenseal. Usually you'll see it as berberine, berberine HCl, Goldenseal. It's usually a complement of a few different parts of the herb. Skullcap, this is another one that has a lot of data behind it for COVID. May block the entry. It's antiviral, NLRP3. Also shuts down inflammation. This is one other product we use. It depends how much you need, what you're willing to swallow, but this has the astragalus, it has the mushrooms, it has the andrographis, and the dose got cut off here, but it's a decent dose. It's a therapeutic dose. Elderberry, so early on, elderberry got a bad rap because it's a Th1 supporter, and everyone, like I said, was afraid to overstimulate the immune system. But I like it. I like it for prevention. I like it for early infection. And you guys have probably heard about this with the flu. Everyone tends to take it this time of year. And it's easy to get a therapeutic dose. A lot of the liquid elderberries have 1,200 and like 2 teaspoons. So now we're going to talk about escalating inflammation, what we don't want. And what happens is if the virus slips under the radar, all of a sudden the body goes, oh my God, there is a lot of this in here. Our defenses are breached. And now there's this upregulated immune response. And this is what leads to the aggressive stages, the respiratory distress, the cytokine storms. Think of the virus as hijacking our immune system. It takes over and it gets out of control. So this is when things get more severe. This is what kills people, as Julian was saying, not necessarily the virus. So what are the risk factors for this cytokine storm? It's the comorbidities, it's the obesity, and we also have to really worry about our healthcare workers because especially early on in this, they got exposed too early to too much and they got sick. Their families got sick because too much of that virus got in before the immune system had a chance to deal with it. So I just want to turn it over to Julian for a few more minutes, and then I'm going to come back and kind of tie this all up for you so he could talk about, how to deal with some of these risk factors a little more specifically. Okay. Hopefully we'll get it right this time.
Hopefully we do. All right. Let's see. Hello again, guys. And just one little plug here about supplements. Dr. Adria had put me on a protocol probably 3 or 4 years ago. And since then, I am consistently on astragalus and quercetin NAC. Neither me or anyone in the family had so much as a cold for the last 3 or 4 years. So that does work. And we see how kids who are little kids and they go to school, they just don't get sick, right? Unlike other kids, everyone in the class had flu, nothing happens. So I warmly suggest to look into the supplementation that Dr. Adria describes and suggests. All right, so let me share my screen once again, and I'll talk about a couple of other things here. All right. Hopefully you can see it. All right, so we spoke about low carb nutrition and how it helps us with lowering inflammation. There are other things that are super important and we want to use them as well. So those things include sports activity, they include intermittent fasting, which we also call time restricted feeding, and sleep and stress management. And this is super important, right? So let's dive into this a bit. When we exercise, when we active, we create tremendous anti-inflammatory response, and it helps us to be more immune, to be more strong. It creates a lot of hormonal response that allows us to be not just happier, but more protected. Now, it's very important to mention that we're not talking about any kind of sport, and especially that most people try to use their sport activity for losing weight. And it's known since probably 70s that cardio activity helps you to lose weight, which is completely incorrect, since it actually does provide hunger. It essentially makes us use glycolytic pathway, which does increase sugar consumption and makes us hungrier after. So we don't want to do that. But let's forget about weight loss for a second. If you participate in tremendously strenuous cardio activity, it does create cytokine storm, and then what Dr. Adria has described happens. Then your own immune system chokes you and causes you to get sick if you get COVID. Now, what is very beneficial are slower activities or shorter activities, and that is mostly strength training, where you're not killing yourself on a treadmill. You're slowly working to increase your muscle and increase your abilities, and that helps a lot with preventing inflammation and fighting infection. And it's not only COVID, it's any kind of thing. Now let's talk about the time restricted feeding, which is also intermittent fasting. It's very beneficial to keep your nutrition time restricted, and it's very known again for reducing obesity, because it helps preventing hunger. It makes you more disciplined, and it gives you windows of lower insulin. But in addition to that, as you can see on the slide, it does reduce inflammation by reduction of monocyte cells in the blood that actually cause that kind of inflammation. And now we'll get to the very, very interesting part, the sleep hygiene. And this is something that would be beneficial to anyone, and it's something that is easy to work with for almost everyone. We all sleep, we all need to sleep, and sleep is free medicine for everyone. It also source of your youth or getting old, depending on how you drive that. Now, if we don't sleep enough, our inflammation rises to very, very high levels, because this is when you sleep during the deep sleep phase of your sleeping, very short phase, by the way. This is where your body heals. If you don't get enough of that sleep, you have an issue and you will get sicker. Many people take sleep medicine for their sleep, like Ambien, and it's important to know that those things do not make you sleep. They knock your prefrontal cortex out, and you're essentially drunk or drugged, but you're not really sleeping, and that prevents your body to heal. And this is why there is very large percentage of Alzheimer patients from the people who were taking sleep medications. So instead of doing that and promote recovery during the sleep, we need to make sure that we sleep well from natural sources. And melatonin, that Dr. Adria has mentioned, is a great source of that. And what I also suggest is to create your own melatonin by controlling your lighting. Now, what happens is when you go to sleep and you're sleepy, it means that your melatonin levels are high and your body tells you to sleep. Melatonin gives you a signal that it's time to go to bed. if you're exposed to bright light, if you eat late, if you have activities that you know, very active, sounds weird, before you go to sleep, then you block in melatonin production. What I suggest is to create a habit of dimming lights before you go to sleep, at least 2-3 hours before that, and make sure that you're producing melatonin by not using your computer screens, by not using your phone, by not having TV in your bedroom, and not using your phone in the bedroom. I also suggest to wear blue blockers, something like that. Those are glasses that create red or yellow light, and they essentially block blue and white bright light that block melatonin production. By wearing those glasses, you would effectively create extra source of melatonin, and you would sleep better. I think at this point I'm done, and I will hand it back to Dr. Adria.
Can you hear me? Thank you, Julian. Okay, everybody, hang in there. We're in the home stretch. Hold on one second. It's hard to go back and forth. Okay, here we go. So let's think about what to do for escalating inflammation and for these pulmonary symptoms. So if inflammation is escalating, if you feel like you're getting sicker and you want to nip this in the bud, we want to tone that down. So it's still safe to use the foundational supplements as well as andrographis and curcumin, but now is when we'd want to cut out those TH1 boosters. We don't want to be overzealous at this point. There's a very interesting theory now that's taking the internet by storm, and it seems to be valid, is that one of the big issues with this, post-viral problems that we're seeing with COVID has to do with mast cell activation. This is going to crank up inflammation. So mast cells, you may have heard of them, they release histamine. So things like Zyrtec are antihistamines. Mast cells are activated, and they're basically told to open up and release their contents when they are encountering allergens or pathogens. So now with these pathogens, with these viruses, these cause the mast cells to release, with fury, a lot of histamine and other inflammatory chemicals, and that can lead to a cytokine storm in the lungs. It constricts the bronchioles. Those are our airways. And it's starting to be shown in the literature again. This was a research article that I found, and it talked about certain specific nutrients, nutraceuticals. Luteolin inhibits mast cells. This is also good if you have allergies. Quercetin works well with the luteolin, and both of these in those hardcore studies I told you where we looked to see if the virus, could be blocked from penetrating our cells. Both of these were the top contenders against a lot of drugs in terms of doing that, in terms of blocking that spike protein. And this was another research article that's showing that a lot of people, many of the people who have recovered or even having mild symptoms are still having problems. And we feel that these problems are very much akin, very similar to what we see with mast cell activation syndrome. PEA, this is also another mast cell blocker. It's a great anti-inflammatory. There's a lot of research on it. It doesn't interfere with medications. You could use it even along with pain medication, especially inflammation, but also neural inflammation, chronic pain. And that this is some research on PEA. And then we think about lung support. So I know I promised you I wasn't going to be boring again, but I really like this slide. GSH stands for glutathione, NAC, and it's showing you how these are involved in blocking the inflammation in those alveoli, those sacs in our lungs, and a lot of the mechanisms involved with causing clotting and thickening of the mucus and all the stuff you're trying to avoid. So for lung support, glutathione, N-acetylcysteine, vitamin C. And this is not unique to COVID. I mean, we use this with our respiratory patients. We use this with flu. We use this with prevention. We use this with asthma. Carnosine is another one that's been shown to be potentially protective against that acute respiratory distress syndrome. And it seems to block, LPSs come from bacterial cell walls, and they crank up all the things that we don't want to see when it comes to an infection. And also this is a mast cell blocker. So this is very interesting that it has multiple purposes. SPM, some of my patients are already on these. Anytime someone has elevated inflammation, they're on SPMs. There has been a ton of research on these. They tell those Pac-Men, clean up the mess. So a lot of times after someone is sick, or even with chronic inflammatory diseases, we see a lot of research. If you Google pro-resolving mediators with Alzheimer's or with inflammatory bowel disease, you won't believe how much research comes up. It's really exciting because part of what causes that chronic inflammation is the garbage that's left behind after the cleanup squad comes in. So, you know, you got the Th1 and the interferons and the natural killer cells and the whole immune system kicking in, and they make a mess. Think of it like a war zone, and now there's all this debris left over, and that just keeps the inflammation running. These clean it up. Debris clearance, reducing inflammatory cytokines. I think these are really critical when you get the virus to prevent and mitigate that type of escalating inflammation. Obesity reduces pro-resolving mediators. So again, here's where we see how the risk factors can be, you know, really aggravated by certain, you know, comorbidities. Then I know a lot of times I mentioned blocks thrombosis, good for vascular, you know, dilation. This is what I wanted to show you. These are a lot of different vascular protective nutrients. And I wouldn't recommend taking them all at once, or you're going to get a lot of black and blue marks, because pretty much every anti-inflammatory is also a blood thinner. That's why you need to always tell us, or tell your doctor, if you're going for wisdom tooth removal or you're getting surgery, because we stop a lot of these a week before. And again, they're very beneficial, but you don't need to take all, you know, 12 of them. And molecular hydrogen. Not a ton of literature about this with COVID, but it just makes sense to me, so I wanted to mention it. It's a really cool intervention that helps with a lot of things. It's an NLRP3 suppressor, quiets down a lot of the molecules involved with cytokine, great for the nervous system, good for anxiety. It's just really helps with the antioxidant response in the body. And it's easy to take. It's kind of like a little Alka-Seltzer. You put it in your water and then you drink up. The only caveat to this, if someone has small intestinal bacterial overgrowth, you might get a bellyache from this. Hopefully you don't. You know, if you're not getting a lot of GI bloating and upset, it's probably a non-issue for you, but I do really like this one as well. So let's talk about what not to do, contraindications. So we have to respect these herbs. Even some vitamins can interact with many prescription medications. How that works is we basically clear and neutralize and even activate our medications through liver pathways. And if these vitamins hop on the same liver pathway, they can either speed up or slow down the clearance. So you can have too much medication you're being exposed to for too long, or it can speed it up and move it through too quickly, so it's ineffective. So we really need, I always run through patients' medications. I look at what liver pathways they're going through, and I make sure there aren't any contraindications. As I mentioned earlier, vitamin C in high doses, contraindicated, even sometimes in what you wouldn't consider a high dose, with kidney stones and high iron levels. And as I also said, many anti-inflammatories are blood thinners. With autoimmune disease, we want to be careful with immune upregulation. If GI concerns, sometimes people get a little belly ache with zinc and vitamin C, so we proceed slowly. I find, again, that if we use lower doses with the C and, you know, throughout the day, or if we use zinc as lozenges, they tolerate them better. So just to summarize, what were the foundational supplements? I guess you understand now why vitamin D is a biggie. I want your D at least 55. With infection, we up the ante, we go to higher doses. And all of these slides are going to be available on my Facebook and my website. So if you're writing like a fiend, just put the pencil down and just listen. Vitamin A, 5,000 typically I use a day, but if someone's sick, we go higher. Some doctors go as high as 100,000. I take a case-by-case basis. I'm trying to give you what I think would be safe. Vitamin C, we up the dose. Zinc with some copper. Glutathione, we start, you know, a little lower, and with infection, definitely higher dose. Same with NAC. Melatonin, it's what you tolerate. The thing with melatonin is you have to leave yourself enough time. If you take it at midnight, you're getting up at 6, you're still going to be drugged at 6 o'clock in the morning. I say give yourself at least 8 hours. So take it maybe an hour before bed, and you should be in bed at least 7 hours sleeping. So that's how you know what your dose is. Some people tolerate 20 milligrams. Some people don't tolerate 2 milligrams, or it takes a little time, or they have to find the right form. Some people do better with a sustained release. So we play with it till we find the sweet spot. Again, more foundational, the elderberry, the curcumin, the quercetin. I have problems with that word, I guess. And then the nasal and throat sprays. Immune support, things for natural killer cells, TH1. These are more the herbs, the mushroom extracts. I mentioned some of the formulations. You can always buy these at tinctures. That's what I do a lot, and I just blend them all together. There are the teas, the anti-inflammatories, the foundational supplements, of course. I explained how a lot of them are anti-inflammatory. Then there's the SPMs, those pro-resolving mediators. Really, if you get a chance, just Google it. Google pro-resolving mediators and inflammation and inflammatory bowel disease and Alzheimer's. You'll be impressed. And then there's curcumin, there's carnosine, there's the andrographis. And if for those of you who I've completely confused and you just don't know how to proceed, we're happy to help you. Feel free to call the office and we can schedule a time to review your supplements and your level of exposure and tell you what would be kind of a happy medium for you to be using. Well, thank you, everyone. It's weird not to see you to say goodnight, but I'm going to say goodnight. And I hope you all enjoyed this, and I see you all stayed on, so I really appreciate your attention. Thanks so much, and thanks, Julian, for joining me. See you all soon, I hope. Bye-bye. Bye, Julian.
Thank you, everyone.